I'm Soledad O'Brien. Welcome to Matter of Fact. Open enrollment is underway for the Affordable Care Act exchanges. It started on November 1st, and with it, a lot of confusion. Some Americans think the Affordable Care Act is dead because the Trump administration canceled funding for the subsidies known as cost-sharing reduction payments. It's not dead, but it does leave the states in an awkward position. They have a shorter enrollment period, 6 weeks. They have less money for advertising and counselors to help people enroll. Consider the situation in Iowa. 72,000 residents have health insurance through the exchange. Earlier this year, Iowa tried to back out of the Affordable Care Act, applying for a federal waiver and the right to set up their own statewide plan. The Trump administration tried to approve the waiver but couldn't because it would raise the national deficit. Doug Omen is Iowa's insurance commissioner, and he joins us from our affiliate in Des Moines, KCCI. It's nice to talk to you, sir. Thanks for being with us. Let's talk about where we are right now. The exchanges are now open. You're down to one provider. That's down from 4. And premiums, we're told, are going to be 56% higher. How are you feeling about what's going to happen in the 6 weeks ahead?
Well, first of all, with the healthcare.gov up, we're looking forward to enrollment. Certainly, the problem that we see, though, is with those increases and the rates that are going to be paid by individuals that have to pay the entire amount themselves, it'll be pretty tough for them this year. For a family that is 62 years old, again, I'm speaking of a married couple, their rates this year will be approaching $40,000 a year. We are very concerned about those people that are required to pay all of the premium because $40,000 will price out of the market most of the Iowans that are in that range.
Iowa wanted to leave the ACA altogether, leave the exchanges. When this went to the administration, they wanted to do it, but they couldn't do it because it would raise the national deficit. So where does it stand now? What do you do next?
Congress needs to fix this, and I've been really clear, and every state official here in Iowa has recognized the Affordable Care Act transferred all of the decision-making to Washington, D.C. As a state insurance commissioner, I really don't have much power to try to make the adjustments that need to be made. So Congress needs to fix it. They need to find a way to reach agreement on what it is that can be done to return the market to the place where it will work. But if Congress can't do it, they simply need to return it to the state because we can do it here in a way that fits our state, fits the needs of our people here in Iowa, and actually will work.
Doug Omen is the Iowa Insurance Commissioner. Thank you for walking us through what's happening in your state, sir. Appreciate your time.
Thank you very much for having me.